Here's a common stressor in dentistry, and that's working with patients that drive you crazy. Why are patients so crazy? I get that question a lot. Well, I'm going to help you answer that question. And the first thing I want you to do is, I want you to think about a phobia that you have. Public speaking, getting in front of a video, spiders, snakes, heights. Those are some of the more popular ones. And I really want you to put yourself in one of those precarious situations. What happens when you are at the top of the Sears Tower, or you see a snake or a spider, or you're in a tight elevator with a bunch of people around you? Do you start to sweat? Can you feel your pulse racing? Your heart's beating out of your chest? Are you all of a sudden starting to get irritable, like people are too close, or don't touch me? That is what your patient is going through. Fear. 75% of Americans have some level of dental fear. Of those 75%, 10 to 15% actually have odontophobia, which is a true diagnosable phobia of being afraid of going to the doctor. So imagine you have a patient who is afraid of the dentist, and they have the fight, flight, or freeze mode. Well, you won't see the freeze people. They won't come into the office because they're frozen. They don't even bother coming in. But you will see the fight and freeze patients. So when they come into your office, the fight patient looks like, crabby and questions everything and doesn't want to fill out the forms the way that you want them to, and has a grumpy face and stern tone. The flight patients, they're the ones that they're going to be there, but they can't wait to leave. So they're always, how much longer? They give you 1-2 word answers, because the more that they answer your questions, the longer they're going to be there. Everything is fine, good, okay, sign here. They sign without a smile or without any kind of chit chat. What we tell ourselves we believe about these patients. So if we say this guy's a jerk, or this lady is rude or not very pleasant, we start to believe that, when actuality what's going on underneath the skin is that they are afraid. And if you have a paradigm shift where you start seeing them instead of the jerk or the rude lady, and you start seeing them as people that are afraid of being there, you know what happens? It changes the way you interact with them. It changes what you offer them and the empathy that you share and how you are comforting with them, instead of being short or being rude back. I've identified 12 different types of patients that are commonly found in the dental practice, and they range everything from the doubter, the entitled, the Scrooge, and with each one of these different types of patients, there are skills, tools that you actually could use to help de-escalate the situation. Because this is what will happen if patients continue to drive you crazy and you drive them out of your practice. You will have a very small niche of a population that you're willing to work with, and that only stunts growth of your dental practice. So some of the tools that you can use, number one, is to learn how to truly express empathy without being condescending. And here are some tips. One, never say, I understand. You can't possibly, you can relate, but there's no way that you can really understand what someone is going through. So instead of saying, I understand, using the I pronoun, instead say, that sounds difficult, that sounds challenging, that sounds horrible. You must be feeling tired by that. Use the you pronoun instead. That actually demonstrates empathy. Another tool that you could use is to learn how to acknowledge and validate. It doesn't matter if you believe them to be true. Whatever they're saying or whatever they're feeling, they believe it to be true. The patient believes that the dentist hurts. The patient believes the dentist is scary. The patient believes that there's something to be fearful of. We know that that's not necessarily the case, but they can't help it because it's their stress response and it's how they react. So learn to acknowledge and validate. You can say to them, thank you for sharing that with me. You really are brave coming here, and we are going to take such good care of you. Let's talk about how you can let us know if you are in pain or if you're too scared, or how we can take this slow. The next thing is really to communicate with their patients and give them an open space to be able to share how they're feeling. If you can master these skills, you then will be able to work with patients of all ages and demographics and really build upon your patient base, grow your practice, and then patients won't drive you crazy.